We need to challenge the myths that exist.
It will never be the case that we will be able to define a specific amount of alcohol that is safe for an individual mother and fetus.
There is no safe amount of alcohol use during pregnancy.
There is no safe time, there is no safe type, and there is no safe amount. When the alcohol passes across the placenta, the fetal liver is actually quite immature and doesn't have the same enzymes to metabolize alcohol. So the alcohol passes essentially unmetabolized into the fetal urine, which is the amniotic fluid, and the fetus actually drinks that amniotic fluid, perpetuating the exposure to alcohol.
Damage to the fetus and the brain during a developmental stage will be a long-term permanent result, and also may be interfering with other developmental steps that take place later down the line.
There is no cure for FASD. Certainly prevention is probably the best strategy, but in pregnancies that have been identified as exposed to alcohol, early intervention may help that child reach a higher potential.
More patients are relying on online information, and I think sometimes they want to look for the answer on the internet that they want to hear.
But there's also a lot of conflicting information even among medical professionals, where there may be even misinformation provided to patients about what amount of alcohol can safely be consumed during pregnancy.
When we take a step back and look at what is really important messages for these women to hear, I think that refraining from alcohol while they're pregnant really needs to get to the top of what we address.
We want women to make informed decisions about their pregnancies.
We really need to be thoughtful about how we shape our cultural messages around things like alcohol use, to remove the stigma, to remove the blame and shame and judgment, and to normalize healthy pregnancy as being a focus for families, including fathers, friends, institutions around healthy pregnancy.
There is proof.
There is proof.
There is proof.